Let's talk about something most of us have in our homes, vitamin D. We think we know what it is, but what if I told you it has a secret identity? That it's a powerhouse drug hiding in plain sight, right there in the supplement aisle.
So let's just jump right into the big question. We all call it the sunshine vitamin, right? It sounds so simple, so natural. But what if that's a massive understatement? What if it's less like a vitamin you get from an orange and more like a potent medication that completely transforms once it's inside your body?
To really understand this, the first thing we need to get straight is that vitamin D isn't just one single thing. There are actually two different versions of it, and where they come from is our first big clue about what's really going on. And here is the absolute key to this whole story. While we buy it off the shelf thinking of it as a nutrient, doctors and scientists see it as a prohormone. Now, that's just a sciencey way of saying it's a precursor. It's the raw material that our body uses to create an incredibly powerful active hormone. It's the ingredient, not the final product.
So these two forms, they break down pretty simply. On one side, you have vitamin D2. This comes from plant sources, like mushrooms, and it's often the kind you'll find in those super high-dose prescriptions. On the other side is D3. This is the stuff our own skin makes when it gets sunlight, and it's what you find in most over-the-counter supplements. But here's the kicker. At this point, both D2 and D3 are just starting materials. They can't do anything yet.
And this is where it gets really fascinating. You can think of these inactive forms of vitamin D as, well, as sleeper agents. They enter your body, but they're dormant. They can't perform their mission until they get very specific activation codes, and that happens in a crucial two-step process.
So how does this activation work? Well, first, whether you took D2 or D3, it travels to your liver. There, it gets converted into a new form called calcifidiol. This is the stuff that doctors are actually measuring when they do a vitamin D blood test, but it's still not the final boss. For that to happen, it has to travel to the kidneys. The kidneys perform the second and final conversion, and what comes out is the real superstar of the show, the active hormone calcitriol.
And once calcitriol is active and on the scene, it has a very, very clear mission. It becomes the body's supreme commander of calcium. It is now a powerful hormone whose whole job is to take complete control of how we use this absolutely critical mineral.
Its first order of business, your gut. Calcitriol signals your intestines to become way more efficient at grabbing calcium and phosphate from the food you eat. Without calcitriol on the job, most of that calcium would just pass right through you.
Next, it targets the bones. Now this is so important. It doesn't just put calcium into your bones, it's much smarter than that. It also helps release calcium from your bones when your blood levels get too low and other parts of your body need it. Think of your skeleton as a calcium bank. Calcitriol is the bank manager, carefully managing all the deposits and withdrawals to keep your whole system perfectly balanced.
And finally, it gives a direct order to your kidneys. It basically tells them, hey, stop letting all that valuable calcium escape in the urine. Pull it back into the bloodstream. And when you look at all three actions together, you see this brilliant, complete system. Absorb more from your food, manage the bank in your bones, and prevent any waste through the kidneys.
So now that we understand just how powerful this thing is when it's activated, let's look at how that power completely changes vitamin D from a simple daily supplement into a precision tool for doctors.
I mean, just look at the massive difference in dosing. For daily maintenance, you might take a couple thousand international units, or IUs. But to treat a serious deficiency, a doctor might prescribe 50,000 IUs at a time, once a week. That's not a vitamin dose. That's a pharmaceutical dose.
And it's used to treat some really serious conditions. We're talking about actually curing bone-softening diseases like rickets, or for people with chronic kidney disease whose bodies can't make that final activation step anymore. It's even critical for making sure that osteoporosis medications can do their job properly. In these cases, vitamin D isn't just a helper, it's a frontline drug. But like any powerful drug, there is a flip side. Taking too much of this stuff isn't just wasteful, it can be downright dangerous. And this risk is maybe the ultimate proof that we have to treat vitamin D with respect. The main danger is a condition called hypercalcemia. Basically, this is when that active hormone, calcitriol, gets too good at its job and starts pulling toxic, dangerously high amounts of calcium into your blood. And what's really important to know is that this almost never happens from the sun or from food. It's nearly always caused by taking way too many supplements. And the symptoms of this are really severe. It can affect everything from your brain to your heart to your kidneys. We're talking confusion and depression, kidney stones, even kidney failure, and serious heart rhythm problems. This is absolutely not something to mess around with.
And that's exactly why using vitamin D as a high-dose drug requires a doctor's supervision. They aren't just guessing. They are carefully monitoring the levels of calcium and vitamin D in your blood to make sure the treatment is working, and even more importantly, that it's staying safe.
Which brings us right back to our big question at the start. After seeing how it has to be activated, how it functions as a powerful hormone, and how it's used as a high-dose drug that comes with real risks, you really have to ask yourself, have we been calling it the right thing all this time? Is it just a vitamin, or is it actually a full-blown hormone that we just happen to figure out how to put in a bottle? It's something to think about.